Hi, and welcome to the Revive, Thrive, and Optimize podcast. I'm Billy Weiss, compounding pharmacist and health and wellness expert. This morning, behind the scenes, producer Mike, and across from me, my great co-host Janet. Good morning, everybody.
Good morning. It's Super Bowl Sunday.
It is.
So you know what I'm going to be doing tonight? Watching the Puppy Bowl.
I'll probably be watching the Food Network. So.
I'll be watching that Puppy Bowl. I don't know. I'm not a huge sports fan, but it's still freezing cold outside.
Yep.
I am feeling like I have this lack of vitamin D and sunshine. It's driving me crazy. We've had snow and ice for 2 weeks.
Yes, we have.
And
which
I'm
is
happy
unusual
to be here,
for us.
which is very
yeah.
unusual for
Yeah.
us. And then we got Valentine's next weekend, so I wore my little special heart.
Nice.
And speaking of heart, I keep seeing these images of, buy this T-shirt with a heart on it. It's Valentine's Day. And I keep, immediately when you see heart, for me, I start thinking about women and heart disease.
Yeah.
And I think about all the people, not just women, but women and men who ask Don and I almost on a daily basis, hey, you guys talk about hormones and heart disease and things like that. Where do I go or how do I talk to my doctor about, do I need hormone replacement therapy? So can we talk about what do we do? What labs do we need? What information do we have to come up with to talk to our doctor, even ask our doctor? What age do we need to be to find out what our hormone levels are and what's normal? And
well,
where do we start?
Janet, that is a loaded question. So, I think that the age question has changed dramatically over the last several
All right, so we're starting
years.
with age, men and women?
Men and women have gotten younger and younger when we see their symptoms of hormone deficiencies kick in.
Younger meaning about what
Well,
age?
so for women, I would have told you before, I would have told you 5 years ago, 40 or 45.
Okay.
Now I'm going to tell you 30 or
30s.
35. Yeah. Which is unfortunate.
My students
but-
that are in their 30s are the ones that I'm
we're
hearing
starting
from.
to see it earlier and earlier that their progesterone levels especially start to drop. And that can lead to some of the, what we would call the more premenopause, perimenopause symptoms of
Can't sleep, joint pain,
pains,
anxiety.
hair and skin aren't as good as they used to be. Yes, anxiety, all those kind of things start to creep in, and they don't necessarily think of hormones because they're, maybe 35.
Right.
But we are seeing their progesterone levels become lower and lower. And I just think that part of it is just, we've talked about it, but the environment that we're in, all the chemicals that are around that weren't around before, the foods to have, I don't know if you saw this week, but there was a thing that come out about processed, I'll call them snack foods, most of them, just being full of glyphosate or Roundup.
Poison.
And we're literally poisoning.
Giving it to our children here, feeding them poison.
I told some people this week, I said, we are literally poisoning kids
and
today.
giving them ADD, ADHD, making all that stuff so much worse.
Well, remember, not only are those same foods filled with glyphosate or Roundup, but they're enriched or fortified with folic acid, which is
poison,
which can directly lead to ADHD.
Yep.
So, and then they have all the colorings and dyes in them, which I think are finally going to go away eventually. It's going to be a while, but that can lead to ADHD. So,
and then
that's not
fast
the
food.
hormone
It's not
question.
just the packaged food and the snacks, but it's also all the fast
It's
food.
everywhere.
Yeah.
It literally. So we're seeing younger women, and I would say for the man that it's probably, unfortunately, about the same. It's
In the
35
30s.
to 40. Yeah, today.
And so for a man, if they're feeling tired, they can't lose weight, they don't have any energy, depression, things like that,
Erectile dysfunction, loss of sexual interest, a lot.
Even
of
in the 30s.
even in their 30s.
All that. So at that point, if they're having any of those or some of those symptoms in their 30s even, when they go to their provider for their annual physical or whatever, at that age, should they say, can you check my hormone levels?
Yeah, I think.
And what would be normal for that age?
Well, normal for that age varies greatly because we don't know, and it would be awesome if all the younger people would know at, say, 20 to 25 what their hormone levels are, what their testosterone level is. Because while one man may at 22 may have let's call it 1,600 total testosterone, and the next man might have 1,000 total, but they both feel and look and act great and have energy and function well. So that can vary. The problem is when you say what is normal today, the the powers that be, we'll call them, have cut what is normal just about in half.
Yeah.
So what was considered normal back in the 1990s is not considered normal today, but considered too high, or what they call super physiologic.
So you mean if someone goes and gets their blood labs done and it comes back and it says their testosterone is 800, they might say that's normal, but really for them, what makes them feel good would be 1,500.
Well, just remember that the testosterone for men used to be 1,593 was, quote, the high end of, quote, normal. Now it is 916 on most labs, and some have gone to 750, which is half or less. So I think where we get into the normal discussion is hard. That's why we need a provider who understands
Hormones.
what optimal is, because normal, I can tell you right now, if I think, and don't quote me exactly, but I think LabCorp says 250 or 264 maybe to 916 is, quote, normal for a man at any age. So let's say I'm a 30-year-old guy and I am just really, really struggling with life. I don't have the same get up and go anymore.
Vim and vigor.
Vim and vigor. I don't. And I don't, I don't chase my wife like I used to or whatever.
And you're depressed maybe.
So I can't seem to lose the belly fat. I'm not motivated to go to the gym. I don't want to play with the kids when I come home anymore. I just don't have the energy. And they go and their level is, we'll just call it 400. So they go, well, you're right in the middle of normal. You're right between 200 and 900. So you're good, man. It's not that. And that's where I part ways with some of the gurus that I've heard on the podcast that everybody's listening to, that'll say, oh, yeah, if a man's testosterone is 700, he's fine. I've heard, I won't mention his name, but
he might be in trouble right now.
Yeah, it drives me nuts that he says those kind of things, because we know, first of all, I don't care what your total testosterone is. I care what your free testosterone is. And because that's what's available to the tissues to be used. So we really should be measuring free, but most providers are going to look at and understand total testosterone. So what's normal is hard to say, but what's optimal is usually, for most men at any age, somewhere I would say where we find they feel their best is somewhere probably between 8 and 900 and 1,500 or 1,600.
Wow.
Now,
if you went to LabCorp, it would come back saying it's too high.
It could say that it's too high. If you're above 916, it would flag and say high. But remember, 1,593 used to be the why now do men only need a 916?
Yeah.
I mean, it's ludicrous that we base it on averages and all these other things rather than what's really optimal for people. So I don't think testosterone levels should have changed for what's optimal for a man. So that's where most men will feel their best. They will get their vim and their vigor and their vitality back. They will not be depressed. They will burn fat. They will be able to build muscle. They will desire sex. They will not have as high risk of erectile dysfunction. They will just have a better outlook on life, because the thing that gets overlooked, and this is for men and women, when I say this, testosterone is a brain hormone. Testosterone is
not just a sex hormone.
No, it is not just sex and muscles. It is very important for the brain. It's very important for the bones. It's very important for the heart. So we overlook that. So a lot of depression it can be low testosterone. In women, it can be a combination of maybe low testosterone,
brain
low
fog,
progesterone.
Yeah.
Yeah. So we have to remember that testosterone does work on sex organs and it does work on muscles, but testosterone receptors are throughout the body, and part of that is in the brain. And so part of that's in the bone. So if you want to build new bone, you got to have optimal testosterone. If you, by the way, and I'll go back and maybe we can do it next time or one of the next upcoming times. I have really dug into to the Traverse study,
Okay.
which is the largest study ever done on testosterone. And I need to just get the figures written down because I can't quote them to you right now. But men on the lower end of testosterone had much higher rates of course, heart disease and all these things. But one of the things that stood out to me the most, I shouldn't say most important, was bone loss, osteoporosis.
For men.
We don't think about it in men.
No.
But when they had low testosterone, they were much more likely to have osteopenia and osteoporosis. So, and I believe that over 65, don't quote me again, I'll have to look it up, but if they fell and broke a hip, there was a 31% chance of dying within the next 6 months.
You don't think about that with men.
You don't think about it as much with men, but when you think about testosterone levels dropping precipitously over the years, you can look at the charts
and see the bone
and
loss.
see testosterone numbers go like that, and you see more bone loss, and you see more heart disease, and you see more obesity, and you see more type 2 diabetes, right? And testosterone plays a huge role in all of these things for men and for women.
So I'm a man. I've got some of these things going on. And maybe I'm in my 30s or maybe I'm in my 60s or anywhere in between. And I decide I want to go to my doctor and I want to ask for testosterone replacement therapy. Now, I'm a man in this case. So I can go to any provider as a man and I can ask them, how do I ask them that? They're going to look at my blood levels and maybe it comes back normal, but I want to say to them and be proactive. Will you, or I want you to give me testosterone. So how do they ask for that and what form should they take and what is it
these
and
are
all
really,
that?
really important questions, Janet.
Because it's not, all testosterone is not the same.
It's not the same. It's not even close to the same. And here's the real tragedy of this and I'll answer the question, but I want to make sure men hear me on this. Let's say you are one of those guys and you go in and your testosterone, let's say it's 400 to 500 total. And you go in and they give you this prescription for a pharmaceutical testosterone.
Which is how, a shot or what?
Well, it could be a shot, but let's just say they're using the cream.
Okay.
Or they're using a shot. It doesn't matter. Number one, the creams, when they are done properly, are much more effective than the shots, and they don't cause the lipid dysfunctions and different things. But what happens is if they give you a small dose, your body is making enough to make that 500 number. Mm-hmm. They give you a small dose of cream or a small dose of injection. They can actually lower your total testosterone.
How does that happen?
Well, you're sending a signal to your body, hey, you're getting this testosterone, so we don't need to make as
anymore.
Much anymore.
Okay.
And they're giving you such a small dose that you will actually sometimes see these men feel worse.
Their numbers will go down.
Worse because their numbers actually go down. Versus if you get a compounded bioidentical cream that you use every day, you keep your levels steady, and if you get an adequate dose, your numbers will always, 100% of the time, go up without any side effects.
All right, so then you're
on a nasty, sticky cream and all that stuff that the drug companies make.
So you want to go to your doctor, get your blood labs checked. You want to ask for testosterone replacement therapy. You want to ask for it to be a compounded cream, not a shot.
Correct.
And
you want to talk to somebody like me or somebody who understands hormones and know what a good starting dose should be for you.
Okay.
Because if not, they're going to underdose you, and you may get the underdosed and the lower levels. And what happens is then the doctor will believe, the provider will believe, and the man will believe, oh, testosterone doesn't work.
Something else is wrong with you instead. Instead, let's put you on an antidepressant.
Yeah. So what happens is now they go tell their friends, and their doctor tells all the patients, oh, that doesn't work. I tried it on some people.
Gotcha.
And what we're doing is we're actually, in many cases, like I say, lowering their dose or not giving them enough to work. when the Traverse study clearly shows that's not the case. And so I guess where I'm going is let's make sure we at least have enough knowledge
education
to refer and say, I looked at the Traverse study, or I'm familiar with the Traverse study. It doesn't increase heart attacks. It doesn't increase prostate issues. It doesn't increase any of the things that they say that it does. And when given in adequate doses, it decreases osteoporosis and heart disease and all these other things.
And that's why I love coming to your wellness summit every year, because you give us the tools, the education, the questions to take in and ask our provider, and we have data and science and things that we can back up with our questions.
That's right.
So and knowing what to ask. And
when you are educated, some providers are reasonable and will say, well, look, I'll do it for you because it seems like this is what you want and you've done some research. They may not understand it, but they're willing to try it. And they will often use the dosages that I have recommended for somebody, which is totally up to the provider to do or not. But some of them will do it. If your provider is not educated and will not hear you out, then you need to find a provider who understands. You don't have to change providers, but you need a hormone provider at that point who will do
hormone specialist, maybe.
Hormones, well, and we got to be careful there too, right?
Well, I'm going to ask you, my next question is going to be, so now my provider is not going to give it to me or doesn't know how or whatever. So now I go to one of these places that are hormones, for more hormones.
Yeah.
All right. So
they took the weekend course, maybe.
So
yeah.
What about people that are getting testosterone shots and then taking aromatase inhibitors?
Well,
tell me about that. Because I'm a man. I'm going to go to a place and going to say, hey, take this shot and take this pill. Tell me about that.
Well, first of all, again, shots are not wrong, but we get fluctuating levels, so up and down.
It's up and down versus the cream, keeping it steady.
Keeping it steady. Because the half-life of testosterone, and half-life is just a fancy term for how long does something stay in the system at peak levels.
Okay.
For testosterone for a man, it's 24 hours.
Wow.
So
if you're taking a shot,
excuse me, 12 hours for a man, 24 for a woman. Wow. I'm sorry.
So if you're taking a shot once a week, you're going to get a spike and then a...
That's correct.
Okay.
So you're on a roller coaster. I tell people you're on the big roller coaster.
Even if you're doing it 3 times a week, you're on a roller coaster.
You are. Whereas if you're applying the cream once or twice a day, the levels are shown to be much more steady. Second, if you are at a provider that has told you to take an estrogen blocker, or you called it correctly, an aromatase inhibitor, or AI, you will hear, do not hear me. Do not listen or participate with that provider anymore.
Why?
Because an aromatase inhibitor...
I know a lot of guys that are doing that now.
I do too. I know a lot of them. An aromatase inhibitor blocks the body's ability to convert that testosterone to estradiol, or what we will use generic term estrogen. Because the theory is that too much estrogen in a man or too much estradiol in a man will give them man boobs, or will make their prostate swell up, or will make them retain fluid, and all this nonsense. When what the studies show is that testosterone is really a pro-hormone, and the majority of the benefits of testosterone comes from the converting to estradiol and to DHT.
Yeah.
So when we take an aromatase inhibitor, we block that conversion to estradiol. That is an old, outdated gym bro bodybuilder theory that if they used an estrogen blocker, they would, quote, dry out more and they would be leaner on stage. Now, I don't know if maybe it did help them dry out a little more, but you do not retain fluid from converting testosterone to estradiol. You retain fluid from insulin being elevated, and then the high insulin causes us, I've said this a million times, to spit magnesium and potassium out in the urine.
Yeah.
And then the sodium is out of balance with magnesium and potassium, and so we will hold on to fluid. Now, it is not estradiol, and the problem is, Janet, these men are at a great risk of heart disease,
right?
Heart attack.
Wait, can you just back up? And because I think most people don't even realize that men naturally do have estrogen in their body.
Absolutely. Men do need estradiol in their body, and they do need adequate levels.
My husband
of
takes estradiol every day.
A lot of men take estradiol capsules, especially men who may have a history or a family history or
Heart
a risk
disease.
of heart disease,
Yeah.
because it is so protective of the vessels and the heart, men and women. That's why we're talking about men right now, but estradiol is also extremely important in a woman's heart health,
Yeah.
in a woman's bone health, in a man's heart health, in a man's bone health. So bottom line, AIs are dangerous. They are dangerous for men to do. And now I know for sure that a lot of these clinics, we'll call them,
right.
that are giving testosterone injections, and they will use an aromatase inhibitor with that. I see it all the time. Anastrozole would be the most common one.
Yeah.
That is a recipe for disaster.
And that's so old school. I remember when we were doing that when we started hormone replacement therapy 12 years ago. That's the first thing that they did.
Yeah,
with my husband.
it's a
They don't do that
very,
anymore.
very common thing, unfortunately, still today, especially for the clinics that maybe, I don't know, would be appealing to the gym bros, we'll call them. The people who just want bigger muscles.
Yeah, okay.
I mean, testosterone will help you with that for sure, but I think we should be using it for overall health, and that's not the way to do it.
Okay.
Yeah, I cringe, makes me sick when I think of these men that are doing that. And a lot of these pop-up clinics that's their theory, that's
what they
their
learned
method,
how to
that's
do.
what they do. Yeah.
So we're talking about men, we're talking about testosterone, we're talking about age, we're talking about levels in the blood, we're talking about how to go ask to get on testosterone replacement therapy. I think we've covered a lot. And it's pretty easy for men to get on testosterone, but what drives me insane, and we don't have time to talk about it this episode, was that women need testosterone. Women make more testosterone in our lifetimes than we make estrogen. And
testosterone is the most prevalent hormone in a woman, actually.
And so
and
why can't women get testosterone? So we'll talk about that next time.
Yeah.
That drives me insane.
Well, it's a tragedy is what it is, Janet. But it is true that it is thought of as a men's muscle sex hormone. That's the bottom line.
And then women go, and when they can get on it, they get on maybe the wrong dose, or they're starting to grow a beard, or their hair's falling out, and there's all these things because people don't know how to do it.
Yeah.
So it can be scary.
It requires
education,
some education and some skill on the provider's part to be able to optimize it for each individual person, because just like the men's dose, the women's dose is the same way. It varies tremendously from woman to woman. We have a good idea where to start, and then we may not, but may have to adjust up or down depending on that woman's physiology and how her body reacts.
Someone came to me this week and said, I got my hormone levels. Can I show them to you? And I said, what's your testosterone? I remember asking her that first. And she goes, oh, it's too high.
Yeah.
They said it's too high for a woman my age. And I think it was maybe 10
Yeah.
or 20.
Yeah.
And I'm like, really? Because mine's like 500 or 600.
Yeah.
And then, they're shaking their head.
Well, Janet, again, there's really no established level on testosterone for a woman. They just haven't done that. But the labs will go, I don't know what they even go, 2 to 26 or 2 to 42, depending on the lab. So, yeah, it's unfortunate because the reduction in breast cancer, the reduction in heart disease, the reduction in osteopenia or bone loss, osteoporosis, is tremendous when women have optimal testosterone levels.
So even a woman, we'll talk about this another week, but you can go to your doctor and you can ask for testosterone. They're going to laugh at you maybe. I don't know. But
well, it depends. It just depends on the provider, and it probably depends on the way you approach it and how much knowledge you do have when you go in.
So full circle again, I'm begging you. I hope that we don't have to wait all the way till next January, that you can offer a course just maybe on hormones that we could do, one weekend or one day or online or something, because back to being the CEO of your own health, having the knowledge, getting the fundamentals, the lifestyle in place, and then knowing how to talk to your doctors.
Yeah, I mean, it is critical, Janet, because we should, like I said, we'll do it next week on women or next time on women. But 1 in 37 women before menopause die from heart disease, 1 in 2 after menopause. What changes? Testosterone, estradiol, progesterone, DHEA. Yeah. Those levels drop. And so when you think about that, you go, well, gracious. And then you know what we just talked about on estradiol for men's heart protection. It goes right over to women, and women's estradiol after menopause will drop dramatically. Yeah. Let's say that.
Yeah.
Along with their progesterone levels, along with their testosterone levels.
So we'll go over the women, the levels, and how to ask and talk to your doctor in one of our upcoming podcasts.
Absolutely. Sounds good.
All right. Thank you.
All right. Thank you. See ya.